Vaginal birth is the best mode of birth in the perfect world. Don't cancel me yet and stick with me. The perfect world is where there is no preeclampsia, no obstetric cholestasis, no hypertension, where babies don't embed in other origins in the human body, where placenta previas and accretors, which are rising by the way because of medicalisation, don't exist, so they just won't exist. Where babies remain in optimum positions and women and people in labour are safe and secure and they feel safe and secure, where they feel supported with a caregiver that they have known through continuity of care. Where babies don't grow too big for the individual woman or person, where diabetes doesn't exist, where women and people have not been previously SA'd and abused, where they have been listened to by healthcare professionals in the past and not left traumatised by previous experiences. Where health has been optimised before pregnancy with good preconception care and any pre-existing medical disorders are optimised before birth with good antenatal care throughout. Where third and fourth degree tears, cord prolapses, shoulder dystocias, uterine prolapses, placental abruptions, they don't exist. Where antenatal education covers everything and where women are given time to talk and healthcare professionals give more than just a 15-minute appointment to listen. Where women don't have to travel to a unit further away because the hospitals are too busy with not enough beds or because of over-medicalisation or because they've shut the local hospital down. Where there are enough midwives to provide that one-to-one care. And so the reality is we do not live in that perfect world and one birth mode is absolutely not better than the other because whilst nature is the biological norm and has helped generations continue for millennia, the one thing that is certain for all life forms is that it ends at some point when solely left to biology and nature. Nature's ultimate guarantee is a penultimate end game, and this is where the evolution of research and science steps in to intervene and carry on the next generation. Pregnancy and birth are not exempt from nature's endgame, and if anything, childbirth makes women and people far more susceptible to the complications and the impacts of pregnancy. And for some women in the world, particularly when social inequalities and deprivation increases, pregnancy can be one of the most dangerous things to experience as a woman or a person, particularly when there's no access to healthcare or safe abortions within this world. And I'm so grateful that the success of science means the success of mothers and babies and children, where there is access and where it exists and where they have decent care. Midwives have not been pushing normal birth ideology for quite some time here in the UK, and we are sat at almost a 40% induction rate and a 50% caesarean birth rate. And CQC ratings across the country are so poor because of the underfunding and understaffing. Funny how one of the longest serving UK health ministers who squeezed NHS budgets, underfunded the system, ignored Morecambe Bay's recommendations of safe staffing and cultural overhaul, where most of the failings in maternity care now are coming to light in the review during this time period where he was health secretary, who did not implement the better birth continuity of care for all women. And actually, women had more continuity of care in 2012 before he was health secretary compared to now, because most women will see multiple different professionals in their pregnancy now compared to 2012 where there was some continuity. And not having continuity makes it less safe because you see the differences as a midwife with the caseload that you have. It makes it harder to spot changes to physiology. Health Secretary had midwives leaving in droves. He closed down beds across the country despite increasing medicalisation needing more, not less beds. He closed so many maternity units which were vital not just for choice in labour and birth, but also provided invaluable postnatal care for women and people post-operative who could go for support, who could go for breastfeeding input. Existing health secretary squashed the RTM calls for safer staffing, who would have made things better, who implemented HSIB, a way to investigate poor outcomes, but only after things go wrong, after an intended vaginal birth. If a baby becomes unwell or is unalive during or following a planned caesarean birth, they are not investigated at all, skewing the results completely, in spite of knowing the increased mortality in neonatal unit admissions following a caesarean birth. This person is blaming midwives at the bottom and diverting the attention from what he did for 6 whole years in government. Midwives are not perfect, neither are doctors, but when we put them in an underfunded system which does not afford them the time to listen or care, when governments do not listen to the calls for help that we have repeatedly put out over the last couple of decades, and they ignore the pleas of the workforce for overhaul, for better leadership, for better staffing and funding, to implement the most evidence-based care models, it is not ideology about birth, it is those who are deciding not to fund it properly. Midwives should be the experts of physiology during pregnancy because when physiology doesn't work, when physiology decides to change, your midwives need to know how and where to refer you to and work with the whole multidisciplinary team, not just obstetricians, but other specialists as well in healthcare, to ensure that you and your baby have the best care and are kept safe. There is no right way to birth a baby. Understanding nature, working with science, working with a holistic partnership is the way forward. Funding women's healthcare, funding care that women and people need, and resourcing the system better is what's needed. Birth workers, doulas, midwives, obstetricians, and most importantly, the women and people in our care all need to come together to find the solutions. It's not about one specific profession. This is and always has been a government choice not to fund maternity care. Midwives are key to ensuring that the right interventions reach the right women in the right situations. Intervention improves outcomes, it improves lives, and it really does reduce neonatal and maternal mortality to a certain point, because there is always a fine line where it tips into iatrogenic harm. She causes longer term harm for those women and people, and in particular in future pregnancies potentially too. Midwife's ideology is not normal birth. I've never been able to define what a normal birth is on paper. What the hell is normal? We are the experts in physiology. We are the experts in physiological pregnancy and birth, and our ideology is continuity of care, individualised and not blanket guideline care, good antenatal education and information and care being provided, and women and birthing people being listened to and supported the entire way through, start to finish, and having the time, the actual time to sit with a woman or person, listen to them, actively listen, and act on their concerns. And that is what the ideology is, purely because the definition of a midwife is to be with women. Thanks for sticking with my TED Talk. There is no right way to birth a baby. The perfect world does not exist, and the perfect system right now does not exist.